Hi everyone, my name is Allison Lucchese. I'm a licensed marriage and family therapist and the program director of OCD services here at Embracing You Therapy. I wanted to shed some light on a lesser known subclassification of OCD known as postpartum OCD. While more information, support, and treatment are sought for perinatal depression and/or postpartum depression, postpartum OCD is an often less talked about issue new parents can face. So part of the reason why postpartum OCD is less known and diagnosed is because of the nature of the disorder. No one wants to feel or have malicious thoughts about harming or having harm come to their child. Talking about this is something that is hard to do, particularly with all of the cultural, societal, and familial pressures that new parents can face, let alone the stigmas. If you have OCD prior to the birth of a baby, there is a greater risk of developing increased symptoms during the postpartum period. Symptoms begin or worsen shortly after the birth of a baby, and obsessions largely center around the fear of accidentally or purposely harming the newborn. Postpartum OCD can also appear in individuals with no prior history of OCD symptoms, and it typically has a more rapid onset, which makes it harder to talk about and seek help. It is vital to screen for and diagnose postpartum OCD as early as possible by a professional who specializes in OCD and truly understands this disorder. Parents should not be afraid to tell someone what they're thinking. Remember, thoughts are just thoughts. However, when these unwanted thoughts become obsessive, irrational, and interfere with one's daily life, they need to be addressed. As we know, a key factor of OCD is the presence of obsessions and compulsions. So here are some common obsessions and compulsions of postpartum OCD. One would be unwanted thoughts or images of accidentally or intentionally harming the baby by dropping, burning, handling too roughly, throwing, suffocating, and drowning. Other obsessions include persistent recurrent thoughts of the baby dying in their sleep, or in some cases, the absolute fear of the unwanted intrusive thoughts of sexually abusing the baby. I'll talk about this one more when I discuss common compulsions. Some things to keep in mind for obsessions is that they are intrusive, they're repetitive, and they're relentless. They are considered catastrophic. Now, examples of common compulsions are excessively and repeatedly checking on the baby during their sleep, avoidance of preparing or feeding bottles and solid food, repeatedly asking family members, friends, doctors for reassurance. So, is the baby okay? I'm not going to hurt the baby, right? So, avoidance of changing diapers or bathing the baby due to that fear of sexual abuse. So, again, repeatedly dumping and remaking bottles of solid food due to the fears of contamination, asphyxiation, or poisoning. Again, these are just common examples of what an obsession and what a compulsion would look like. And of course, it influences the attachment that one can have towards their newborn. All of this sounds scary, right? It's not the presence of these thoughts that is the problem, but the meaning and responses we apply to them that prevents us from living the life we want to live. Fortunately, postpartum OCD can be effectively treated using the same evidence-based interventions used with other OCD presentations. So cognitive behavioral therapy with an emphasis on exposure and response prevention is considered the gold standard in treatment. If you or someone you know has experienced any of the symptoms, obsessions, and compulsions I've discussed in this video, I really encourage you to talk to someone you trust and become more informed about the postpartum OCD. Becoming informed and finding a therapist that specializes in this condition is important when seeking help. As always, if you have any additional questions, you can leave us a comment below or contact our office for a free consultation. You can also visit our website, embracingyouTherapy.com, for additional information.